The hospital clinical microbiology lab investigates specimens from many different patients. Here in endocrinology, we send specimens from patients with suspected diabetic foot infection. Here, the patients with diabetes may have lower limb neuropathy and associated loss of sensation and poor wound healing. This in turn can lead to infection. When an infection is suspected, a swab is taken. We then need to decide if the patient needs antibiotics there and then, or whether we can wait for the results to come back. If the patient is unwell, we usually start antibiotics which cover the most likely pathogens, as we would be worried the infection might progress and the patient develops sepsis. This is called empiric therapy.
I attend podiatry to keep an eye on an ulcer and hopefully prevent it from becoming infected. I see a whole team of healthcare staff to monitor my ulcer, including podiatrists, endocrinologists, vascular specialists, and diabetic nurses.
We provide patients experiencing foot ulcers with several therapeutic interventions like offloading boots, pressure relieving devices, and debridement, where we physically remove excess tissue from the wound bed to promote wound healing. We check the patient's blood supply and the level of sensation they have to see if they're suitable for debridement first. Preventing infection is really important, as these can cause serious complications that may lead to limb amputation. So if we suspect an infection, we get that checked out. We take a deep sample with as much exudate as possible. That gives the microbiology scientists the best chance to identify a pathogen if it's there.
In the laboratory, the specimen will go through a number of different stations, starting with here, specimen reception. There are many different systems to track a patient's specimen throughout the laboratory and make sure that the correct tests are performed on the correct specimen. In this laboratory, specimens are barcoded and then catalogued in the IT system. Depending on the type of specimen, a specimen will be worked up on different benches or different stations. So for our specimen from our patient, it'll be worked up on the wound bench. Our patient specimen will be swabbed first onto a number of different agar plates and then placed in an incubator for 24 to 48 hours to grow any potential pathogens. The idea of the different agar plates is to try and grow different types of pathogens. The idea of the incubator is to create the conditions that allow our pathogens to grow on the agar plates. At the wound bench, we check a variety of patient specimens. This includes specimens from patients with wound infections, throat and ear infections, and also deeper specimens from the operating theatre. So, for example, a patient might have an intra-abdominal abscess, and the specimen is sent from the operating theatre immediately down to the laboratory so that our scientists can start the process and see what pathogens will grow.
The following day, after the agar plates are taken out of an incubator, we inspect them for bacterial growth. From the growth pattern, this looks like a Pseudomonas and it has a green hue. We can also do an oxidase test, which helps us confirm Pseudomonas quickly. This growth is quite different to other bacteria that we often get from wounds. Like this one here is a Staph aureus, which is one of the most common bacteria we isolate from skin swabs where infection is suspected. However, to identify the bacteria definitively, we need to send the isolate to the MALDI-TOF, which we will tell you about later. This gives us a quick result. Once we know what the pathogen is, we also need to find out which antibiotics are likely to kill it and which should be avoided. This is known as antibiotic susceptibility testing, and manual methods require another day's incubation before we have those results. Essentially, we grow bacteria in the presence of antibiotics, either using discs on agar plates or in automated analyzers. After overnight incubation, we check which antibiotics prevented bacterial growth and which did not. Moving on to technologically assisted antibiotic susceptibility testing, the MALDI-TOF is an automated testing platform for definitive identification of pathogens. We use it every day to identify pathogens from single colonies that have grown on agar plates. The device produces a peptide mass fingerprint based on the specific protein profile of the bacteria. The device compares this fingerprint to a database of known pathogens to give us the name of the pathogen. One way we can decide if a particular antibiotic might work is by looking at these antibiotic susceptibility agar plates, which we incubated yesterday. I am looking at a clear zone around this antibiotic disc which indicates that this particular antibiotic is killing the bacteria. If the bacteria is growing up to the disc, that means that the antibiotic is not killing it. By comparing these measurements to international standards, we can tell if it's an antibiotic-resistant pathogen or not. Instead of looking at agar plates with antibiotic discs, we can also use automated platforms to do the same thing, such as this machine. The advantage of this is you can test many more antibiotics at the same time than the agar plate. It also saves us time so we can work on other patient specimens.
The clinical microbiology team check in with the medical scientists every day on our laboratory rounds, and we're doing this to see if anything is growing on our patient specimen. And we interpret the results in the context of that individual patient. So, for example, we're looking every day at what's possibly growing. Then, in consultation with the patient care team, we recommend the appropriate antimicrobial, and we may also recommend other tests and investigations.
As you've seen, medical laboratory, science, podiatry, endocrinology and clinical microbiology teams work together to provide the patient with an antibiotic management plan that, together with other therapeutic interventions, ensures the best possible clinical outcome for the patient.